Hello, people. How are you guys? Happy Saturday. It's actually a very cool day here in New York. So, you guys, I'm here again, and my name is Ify. So, I know you guys are still new on this platform. I haven't done any formal introduction of myself. I'm still going to do that. So we're just starting. So I'm going to do a very, very formal intro of myself later. But I need to build up my audience first so that I don't have to do it again. So like I said initially, that I'm not going to... I'm trying to make my videos very, very informal, because the information I'm bringing out here is for basically people who have like a low health literacy, like not people who are who are informed in health issues. So I'm gonna be very, very simple in my use of words. I'm not gonna be using all those medical jargons and all that. So I'm just gonna keep it simple because that's my audience. That's the people that I want to reach. People who have questions, people who go to see their doctors, their healthcare providers, and they have questions and they don't know like how to put it out there or how to ask their doctors. So like I always say, anytime you see your doctor, your healthcare provider, make sure you're asking questions. It is your right. Your doctor prescribes you a medication. Ask why, what, how, when, what will happen, what's the side effect. So that's one thing I want to bring out here, because my goal for this YouTube is making you in charge of your health. Be your own health advocate, because your health actually starts from you, not from your healthcare provider. Okay, so you have every right to ask questions. Ask your healthcare provider, why are you giving me this meds? Or what's the side effect? Is it gonna work? So it's your responsibility to explain all that to you. Okay, so for today, if you see right now, I just came back from work, and sometimes while in the field working, I have those thoughts, and then I'll put them down to share with you like what I experienced in the field. So also know that you're gonna be seeing me coming out here very informal. You're not gonna be seeing me every time in scrubs or in my white coat. I just want to keep it very simple. I want everyone to be comfortable with me, and feel free to ask questions. And I also see people already inboxing me through my Instagram page. If you have questions, private questions, please don't do it on this YouTube channel. Go follow me on my Instagram page. What's my Instagram page? Oh God. So I'm gonna put it below this video, my Instagram page. You can follow me there, and then DM me for your private questions, okay? And then I'll reply you privately. All right. I'm also gonna try to open up a Facebook page. I don't have a Facebook page yet for this program. I don't know what to put it, but I do have a website. So if you go to my Instagram page, you're gonna see my website and the things we do. Actually, we do speak to people, we organize seminars, workshops. So just go to my Instagram page, you'll see the website link, and you can always click it and see what we do and then understand. So this page, YouTube, basically is giving back to the community, while I also use YouTube to improve myself. So I'm going to be giving out a lot of free information through this YouTube platform. And if you have any questions, go to my Instagram page and DM me, okay? No emails now. I can't respond to all emails, okay? So today I'm going to be talking more about like blood pressure, hypertension. I know that's a very huge, broad topic, broad issue in the community. So like most people will always ask me, when is it right to start taking blood pressure medications? Some will be like, oh, my blood pressure is always good, sometimes high. So there's so many things involved with blood pressure. The heart, your vessels. It could be genetic. It could be stress. It could be an organ, like sometimes the kidney also, like people who have some issues going on with the kidney can affect blood pressure. It could be your diet. It could be your weight. I've seen people who are overweight, and after they lost a lot of pounds, their blood pressure became normal and they were taking up their blood pressure medication. So I've seen the one that is genetic, and those ones might have to be on those medications for long term, a very long time. Okay, so if you're talking about just blood pressure alone, we have different stages, right? So everyone knows that your normal blood pressure, I don't know if any of you have ever checked your blood pressure. So when you check your blood pressure, we have the top number and we have the bottom number. So the top number is what is called systolic. I promise I'm not going to use those medical jargons here. So the top one usually is higher. So that top one actually measures how your heart contracts, all right, while pumping blood, right? So that should be 120 and below, like 120 and below. When I say 120 and below, there's a cutoff, maybe 100 to 120. And then the bottom, which we call diastolic, is actually when your heart relaxes, how the blood feels into the heart when your heart relaxes. You know, you have different chambers of the heart, blood flowing from one chamber to the other. So how it fills up in each chamber is what is called the down one, which is usually 80. We usually want it to be between 60 and 80, okay? So at a time, you begin to notice that the top one is going above 120. So 120 to 129, you don't really need any medication. And the down one, still 80, you don't really need any medication. And remember what I said, only high blood pressure, because there might be other things going on. There's what we call cardiovascular risk factors. Like there are other things that we put in consideration before we put you on blood pressure medications. Okay, so somebody might have consistent elevated blood pressure, 130 over 139, 130 to 139 over 80. We might not put you on any blood pressure medication. So we're going to check to see if you have other risk factors, like if you're overweight, if you have cholesterol issue, if you have what else? Like if you have like a heart disease, or if basically your cholesterol, weight, a heart disease, history of stroke, heart attack. So with that, we have to put you on a blood pressure medication. So another thing again is like when your blood pressure, the top one is 130 or greater than 130, or within 130 to 139, and the bottom is let's say about 80 to 89. We're also going to check the risk factors that I said, and then we'll put you on a blood pressure medication. Okay, so sometimes the blood pressure could be 140. The top one will be above 140 and above, and the bottom could be 90 and above. Then you definitely need a blood pressure medication. So in that case, we're not going to be considering your cardiovascular risk factors. We immediately put you on blood pressure medication. So usually, like I said, if the top one is 130 to 139 and the bottom is at 80, 89, we're going to be checking for other risk factors before we put you on blood pressure medications, okay? And so usually what we do at that time when we're not putting you on blood pressure medication, we'll talk about lifestyle modifications. So we'll talk about reducing salt, exercise, walking. Like if you check one of my videos that I put up yesterday, I talked about walking, how walking, being active, can help you burn calories. So that's not only helping you burn calories, you are also helping your blood vessels contract. All right, so blood pressure usually is pressure in the vessels of your body, in the arteries of your body, and also the arteries of your heart. So that's why medications is either acting on the arteries of your heart or the arteries of your body, like the what we call peripheral arteries. So I want to keep it very simple. Okay, like I said, hypertension, I'm going to be talking more about that, but based on your questions, I don't want to come out here and start like talking. I want you guys to ask me questions. Okay, so ask me your questions. Go to my Instagram page. I'm gonna put it below this video. Follow me on my Instagram, and then you can DM me through my Instagram your questions, and I'll reply you privately. I'm not gonna put it up here in YouTube. Okay, so if you have questions about hypertension, let me know. So you need to get a machine, especially as you turn, people say maybe 30, but I'll say 25. Okay, so you get your blood pressure machine maybe once a week or once every 2 weeks, depending on the age or the risk factor in the family. If someone in the family, like a parent, has blood pressure, then you should start taking care of your health, especially the salt, being active, and reducing alcohol, and so a lot of stuff, like I said, affects hypertension. So like I said, when to start taking your blood pressure medication, speak to your primary care provider to know when to start. And another thing, don't just stop your blood pressure medication and say, oh, it's not normal. You never stop your blood pressure medications yourself, because there's what is called rebound. Your blood pressure can go spike so much if you suddenly stop it. And there's some blood pressure medications that when you stop it suddenly or abruptly, you're gonna have like what we call is a rebound, like effect of a withdrawal. So don't do that without speaking to your primary care provider. Okay, so if you have questions, please go to my Instagram page, DM me, and then I'm gonna reply you over there. Okay, all right, have a good evening and take care. Bye bye.